6 tips to help you get pregnant naturally fast. Hi, friends. I'm Dr. Natalie Crawford, a board certified OBGYN and REI. So I'm a fertility doctor. And today I want to talk about how you can get pregnant faster if you're trying naturally. First of all, I want to say if you are trying, I'm there. If you have infertility, recommendation not even covered in this video is to go get an evaluation. And in fact, you can get fertility testing done without even having to prove you have infertility. Infertility is defined as trying to get pregnant for a year without success. And at that point, you should absolutely go get tested. If you're 35 and older, you should get tested after 6 months. But let's say you're earlier, you're just trying to optimize every month. What should you do? That's what we're covering today. Please remember to like, subscribe, leave a comment, and you can check out my new book, The Fertility Formula. One of the first things that you need to do if you're trying to get pregnant is going to be to track ovulation. In fact, most patients that I see in my clinic who tell me that they're tracking their cycle, they're simply marking cycle day 1 on an app, and you may be shocked to learn that apps only accurately detect ovulation 20% of the time. So unless they're using some other method of fertility awareness, which I'm going to cover really quickly, these apps are wrong. So if what you've been doing is just having sex during those fertile days on your app and not actually tracking your ovulation, you may be missing the window completely. This is because the egg only lives for 24 hours, and so timing intercourse is so important. There are 3 main ways that you can track ovulation, which is going to help you immensely. One is going to be basal body temperature, another is going to be cervical mucus, and the third is going to be urinary hormone monitoring. What we want to think about really quickly is that as an egg is growing and maturing, it's making estrogen. That estrogen is going to change the cervical mucus. When the egg is matured and that estrogen talks back to the brain, then the brain's going to send out a signal of LH, which is a hormone you can check in the urine. And then after the follicle ruptures, releases the egg and reforms, now it is called a corpus luteum that makes progesterone. And fun fact, progesterone raises your core body temperature by about 0.4 degrees. So if you catch that shift, you'll actually know when ovulation occurs. So there are these 3 different things. Number 1, BBT, basal body temperature. If you check your temperature every morning, you then see it increase. We then know that you have in fact ovulated and you made progesterone. In fact, your body temperature drops before it rises. So the nadir is actually the follicle rupturing and ovulation. This can be really hard to track, except now this is where technology has made this so much easier. Natural Cycles is a great app, and you can leverage it with Oura Ring, their own wearable, or an Apple Watch. And these wearables are giving you such a more sensitive depiction of your temperature that they're highly accurate. The second is going to be using cervical mucus monitoring, and this is free and easy, so I do recommend it. For cervical mucus monitoring, as that mature egg is making more estrogen, that estrogen changes the mucus that is at the entry point of the cervix. It becomes sticky, stretchy like an egg white, and it comes right out of your body. To check your cervical mucus, all you have to do is wipe with toilet paper before you go to the bathroom, look at the toilet paper, and if you see something that resembles an egg white, that is type 4. Ovulation is considered the last day of type 4 cervical mucus. And then urinary hormone monitoring is another great one. These can be with LH only testing called OPKs, ovulation predictor kits, or there's fancier urinary hormone measure based systems that can check multiple hormones. But what you're looking for is a surge in LH. LH is that hormone from the brain that allows the follicle to rupture, therefore detecting your ovulation. Now, this is one clue in a greater picture of cycle awareness and do you have a normal cycle? We'll say loosely you should have a regular, predictable cycle. It should be around the same length every month. Your luteal phase, the time from ovulation till your next period, should be at least 11 days. And if things are abnormal, irregular, lots of spotting, that all needs an evaluation before you start trying to get pregnant. But once you know when you ovulate, then we can go to number 2, and that's time intercourse appropriately. One problem that I see is people have this idea that they need to save up and they are not having very much sex, especially if they're a couple who used to have a lot of sex and now they're pulling back. Sperm can live in the female reproductive tract for up to 5 days, but the egg only lives for 24 hours or 1 day. This is why we define the fertile window as the 5 days before and then ending on the day of ovulation. Intercourse in this window is the only time you will actually get pregnant. In fact, a study was done looking at sex throughout the entire cycle and showed that after ovulation, you have a 0% chance of conception. So we want to make sure that we're getting some sperm there before, but ideally the day before and the day of ovulation are the 2 highest days. So if we know when ovulation is occurring, we're able to time intercourse. So if you are using a basal body temperature, you should use it with natural cycles. It'll tell you when you're in your fertile window. We're looking for the day your temperature drops before it rises. If you are doing cervical mucus, we want to time it for any day you have a type 4 cervical mucus. And if you're using the urinary hormone monitoring, when you have the LH surge is the day before ovulation, so day of the surge, and the next day, those are going to be the top days. Tip number 3 is don't save sperm. So often I see guys with this idea that I'm going to not ejaculate and store up so that when we go have sex, I'm going to have a large volume of sperm. This is flawed because men make sperm 1,500 sperm every single second. So we're making tons of sperm. And if we don't ejaculate them out, we are actually just letting them build up and they get debris and they get damaged. So you can have sex every day in that fertile window. If you are a sex everyday couple, have sex every day. The end. If you're not used to having frequent intercourse, then we do worry that if you have sex every day, maybe you'll burn out and you won't have it when you are ovulating. So there's a balance for every couple and there's not a one size fits all. But even if you're not, frequent ejaculations can be advantageous. So not ejaculating for 4 days or more increases damage to the sperm. So definitely recommend frequent ejaculations. And fun fact, when men have low motility, one thing we might do is tell them to ejaculate every single day so that we get the most motile sperm present immediately. Tip number 4 is going to be not use lubricant unless you need it. You may not know that mini lubricant is just providing an extra barrier for sperm to swim through. We will see marketing that says, helps you get pregnant faster. And no lube is going to help you get pregnant over nothing. Caveat is unless you can't have sex without lube. So if you do need lubrication in order to have a more comfortable sexual experience, then absolutely make sure you're getting one that is fertility friendly. These, for the most part, are going to be certain oil-based or hydroxyethyl cellulose-based lubricants. We want to avoid those that can be toxic or spermicidal. Think your classic Astroglide, KY jelly, but actually saliva is the worst thing that you can do. Number 5 is I need you to stop using cannabis. This is probably the number one thing I see in clinical practice that people are doing that's hurting their fertility. For women, you get fewer eggs with IVF cycles, lower pregnancy rates, higher miscarriage complications for cannabis use in the year prior to conception. And for men, using cannabis decreases sperm counts, motility, shape, increases the DNA damage, increases miscarriage in your partners. This is a modifiable factor impacting your fertility on multiple layers. So absolutely say, just cut the cannabis out. Let's make our goal on getting baby ready right now. And it takes 2. Remember, 50% of infertility is female, 50% is male. We really want to both approach this. And again, the sperm lifespan is about 3 months. So a wonderful opportunity for intervention is to say, we're going to start eating better. We're going to avoid toxins in the 3-month time period. We call this trimester 0 before you're ready to get pregnant. And this is going to give you the highest rates of success possible. And that's number 6. Pay attention to trimester 0. How you prepare your body, how you're exposed to inflammation does impact egg quality, ovulation, implantation, sperm quality, and pregnancy success. So eating a diet high in fruits, vegetables, and fiber, taking a prenatal vitamin with at least 400 micrograms of folic acid, making sure that you're avoiding endocrine disrupting chemicals and toxins to the degree that you can, making sure you're getting enough sleep. These are all important variables that impact your daily inflammatory burden, and they do in fact impact your fertility. Hopefully this video gave you a couple tips that you can leverage if you are trying to get pregnant. Again, if things are wrong and you can't have intercourse, you can't track ovulation, your periods are irregular, please go see a doctor right away. We can always do fertility testing earlier. At the end of the day, it's just data about your body. And let me know your questions below. Don't forget to check out my book, The Fertility Formula. Thanks, friends.